What happens after the rhinoplasty?
So you mean to say basically the recovery process, right? Yeah. So post rhinoplasty, there are a few visits that are necessary to the clinic for me to, assess, to see, and to remove the stitches, to remove the plaster. So basically, you need about 2 weeks to recover, a ballpark figure, because you have a plaster on your nose, you have stitches, and you have tapes. So initially we remove the plaster after 1 week, then we take out the stitches, very tiny ones, frankly. And last week we take out the tapes. So once those 2 weeks are done, you're free. Then you can flaunt your new nose.
So during those 2 weeks, what all restrictions do you advise?
More or less stay indoors. Don't expose yourself to dust. Avoid coughing and sneezing. These are the standard things that we usually tell. In the first 1 week, of course, avoid driving, avoid strenuous activities. You can work from home. There's no problem with that. And
Can you wear specs?
oh yes, you can, provided your specs has those pegs which you can adjust, because you will be having a plaster over here. Very practical pointers, frankly. So you can wear your sunglasses, you can wear specs, you can wear a mask, you can do most of the stuff what you would regularly do. Of course, avoid bending forward as far as possible. Definitely avoid smoking. No smoking for at least a month, because that detrimentally affects the skin recovery and the healing. Yes, exactly. So very, very basic restrictions. Gymming, it's common sense basically. You should not exert yourself at that point of time. But day-to-day activities are permissible, not a problem.